am so excited to have two very special guests today. One is Dr. Jeff Glad, and we have Dr. Kresge, who is, I don't actually know what you do for Rupa, because your title keeps on changing. So please share it with everyone so we know exactly what it is that you're doing.
Well, this is part of the big news that recently our company's joined forces. And so I used to be head of medical education at Rupa.
That's what I know.
Which is why we are such good friends.
That's right.
And now I'm Director of Medical Partnerships for Labs at Fullscript.
That's amazing. Director of Medical Partnerships for Labs at Fullscript. Okay, so for anyone who's watching, you either been living under a rock, or you know that Fullscript has acquired Rupa Labs. And I just want to say for myself, like, we have a beautiful relationship with both companies, and we love working with Fullscript and have for a very long time. And we absolutely love working with Rupa, and we've done a lot of amazing work. So we always felt like we had like two best friends, and we were like, how do we not tell the other best friend about the other best friend? So I don't think anyone was happier about this than I was, but it's a really, really big deal. So just like either of you, just kind of like, what is the why of this amazing acquisition, and what does that look like for 2025?
Yeah, so Fullscript has really prided itself on being the platform for dispensing healthcare's best supplements. But we've always desired to be the full script for the practitioner. And that means more than just supplements. So now we've moved to become a whole person care planning platform. And one of the key parts of delivering whole person care is lab testing. That's right. Data, right? Understanding the unique needs of that patient, but also having markers that give them the desire and the reason for taking certain, lifestyle pathways, supplement pathways. So for us, we felt really strongly that labs was the next sort of horizon for us. So earlier this year, we built our own lab solution and have the National Quest account for cash, which is now pennies on the dollar compared to what patients are sort of getting charged out in the market or in these direct-to-consumer spaces. But we've always sort of loved what Rupa has done, and even I remember speaking to Tara early days, calling themselves the Fullscript for Labs.
Okay, all right.
So they did the same thing for labs that we did for supplements, which is create and solve problems, not create problems, solve problems for practitioners, right? Have a platform that instead of having 15 different lab accounts, you have a Rupa account and you have access to all of the industry's best labs. And so it was a perfect company to acquire and bring under Fullscript to really supercharge what we're doing for practitioners.
I mean, I cannot agree. I'm going to give you a chance to talk, but we actually saw this coming long before you guys did, because one other thing about 3Explore is people always say, like, why do a genetic test? Like, what is the value of doing a genetic test? And there's many reasons, that I won't get into, but two of the key reasons is we talk about precision testing. So you can use genetics to really be able to figure out where do you want to focus on this patient and what labs would be really useful and insightful for orders, so that we're not over testing, over ordering, and we can actually really say, like, this is what this patient needs to get this information, and the genetics is going to give us the why. The second thing we always talk about is targeted supplementation, right? We've been talking about this for decades, saying we use genetics to really identify what are the best possible supplements to use. So we're not sending you home with like bags full of supplements, so that we're using your money in the cleverest way we can. And so we had you guys, like, we knew that was a solution, and then we just had to wait for you to kind of figure it out. And
we appreciate your point.
I know, totally. But maybe, Kate, from your side, like, coming from the Rupa side, like, how did you see this amazing relationship?
I mean, I was overjoyed when I learned that this was finally happening, because I had wanted this forever. As a practitioner, I had been using both platforms for a long time. And I think for all of us, actually, the provider is in the center of everything we do. How do we help these people who are doing such amazing work, these functional medicine practitioners, to reach more people at scale? Because we have a desperately hurting and sick bulk. And so we can't afford to have people spending more time charting or spending more time trying to build a meal plan based on not enough data. Whatever it is that we can solve with tech, we want to. And we also build for practitioners. I mean, you're the same way. Whatever practitioners tell you they need, whatever the science says is best, you're going to build for that. And so for a while, I just, we would sit in calls with our practitioners and they'd be asking for more solutions. And so when I heard we were teaming up and 10xing our engineering capacity, I thought, oh my God.
Especially that part. We love the 10xing engineering.
Like, imagine the things we can do for our practitioners. So Rupa saved me 15 hours a week in practice when I was a solo prac. I didn't have to order kits, stock kits, ship them, explain them. There was an amazing free customer service team for me. It was the same reason I had used Fullscript to begin with, to save time, to give my clients the best pricing I possibly could, because those patients were coming to me when they didn't have a lot of money. Right. And so all of these allow us to be very strategic in helping practitioners to help more people better.
So I'm going to just put it through the way I see it. Like, I think it's a beautiful, beautiful acquisition, and 2 reasons. And I think both companies bring such unique skill and such unique value to the clinician. So for me, the one thing I love about Fullscript is the concept of whole person care. And it's not that Rupa doesn't, but I think that really it has been so much part of the DNA of Fullscript. And I think, if I'm not mistaken, that's really where you see the future of healthcare going. So maybe, and then if you can tell us a little bit more on what is meant by whole person care, and then I'll tell you what I think Rupa's done well. But let's talk about whole person care.
Yeah, and that's been a big repositioning exercise for us, right? We were here, last year and talking about the platform for integrative medicine. But now we see this opportunity for all of medicine to have more of this perspective that Fullscript has believed strongly in ever since its sort of beginning, which is health is a lifelong journey. It is proactive and preventative. And third, which is really important, it's best in partnership with a practitioner.
Yes.
And so, what we found is we're talking to practitioners around the country who are more allopathic in their clinic models and their training, but they see the value of those 3 principles, and they're talking to patients about their nutrition, about their sleep, about appropriate supplementation, but they're not integrative providers. So how do we create the biggest umbrella so that all of us can live in this same, world and deliver this care? I mean, Fullscript is passionate about creating whole person care as the standard of healthcare. And that's really what's most exciting about coming together, and really, what Kate and her team built in Rupa University and what you have at 3x4 in terms of education, that's the key, right? The more you talk to these practitioners that got none of this in medical school, they want it, but they need the education. They need to understand. And I think both of us have created really elegant onboarding journeys for the practitioner to understand the principles of what this is.
So you kind of stole my line.
You're welcome.
No, but thanks for that, Jeff. Because while I was going to say it, that the one thing that I thought Rupa and Rupa, Dr. Kate, had really done an amazing job of was education. And there are a million things that Fullscript did brilliantly, but I think what Rupa really, really did beautifully and committed to and invested in was educating the clinician. And we did a boot camp, we've done live classes, we've done webinars, we're doing another boot camp, early 25. And I have spoken to so many clinicians who really grown and upskilled from that engagement. So to be able to see, and maybe you can comment on, Seamus, it's you. Maybe you can comment on that, yeah.
Being a huge team,
I can see the same team here.
I would say actually that, first of all, that means a lot, because especially the education platform that you guys have. And you were so generous to our team actually in coming to educate on our platform. And actually we learned a lot from you. And I think that's something we've been really committed to is taking our cues from our practitioners. So we really just build what they ask for. But I think what we've gotten a lot better at in the last few years is actually centering the experts. Finding the experts, centering the experts, and building that relationship with the lab team who has the information and the expert tools. And so it's been a really cool journey, I think, over the past few years of just actually being able to really just do that warm connection between a practitioner who's brand new to a certain type of testing. They want to know who are the experts, and we just help guide them there.
I mean, I think that's the key, right? It's collaborative education. If you haven't used that word, you can use it. You can take it from me, but I think it's a pleasure. All right, I have been telling everyone how wonderful Fullscript and Rupa is, and now you get to talk about 3x4. So
Love it.
you can go first. Why? I mean, we have an amazing partnership with Fullscript, and it's just getting better and better. So maybe it's all, it's one thing if it comes from me, but maybe you can speak to where do you see the value of having a company like 3x4 Genetics as part of this whole patient journey?
Yeah, I mean, we've known each other for years, and whenever we've talked about labs, even before we were building,
Yes.
3x4 was one of the keystone labs that was going to be in that platform. Because what you've built as a practical interpretation of taking very complicated data and handing the practitioner the focus here as the priority, guide your patient with lifestyle and, from a nutrition perspective, what fitness routines they should focus on, what supplements, which lab tests to focus on. It is just an incredible start of a patient experience, but also listen, even further down, the path of that patient journey. We talked about this yesterday, the patient's dealing with and struggling with detoxification, right? Bring the 3x4 test in and see what's happening and how can we solve that at the root issue. Is a really incredible thing, right? And what we're seeing now, patients are, they have so much content handed to them in podcasts and books and do their own lab testing. They're incredibly confused. They all demand, really want a practitioner in the loop. And now we have, this partnership to be able to hand the practitioner an easy way to start that patient journey, understanding what biomarkers to focus on, what lifestyle aspects to focus on. And so we just, and yeah, of course, what supplements to focus on. But, to your point, prioritize, right? It's not test supplements. What are the 3 most important things this patient should be taking and tracking over time, and really bringing that practitioner and patient together to kind of kick that journey off and maintain that for a lifetime?
Couldn't have said it better myself. All right. Okay. Beat that.
All right. As Betty, so I think turnkey, actually you said something close to this, and that's how I feel about the 3x4 test. So much of what we hear from providers when they are new to root cause medicine is they are so excited about a test, but they get the report back and they feel completely overwhelmed. They don't know how to tell their patient what to do with it. And it never happens at the 3x4 because of the way the test has been designed. First of all, you have a PhD, been studying this for decades. And so I love that we can trust that your test is designed for clinicians to do effective targeted care. So the test only includes biomarkers that are clinically relevant, right? So if then what? So I get these results back, we are going to then do something about it. And it's also designed with a team of food as medicine experts. So there's actually direct correlations to lifestyle and food, which we know are playing such a big role in how we to turn the tide of chronic disease in this country. We need it more than ever. But I think there's also been a craze around SNPs and methylation in the past few years. Yep. And so we often get providers coming to us quite excited, and then they need to be trained. And what I love is the second they get their first test back, you are training them through the report. With the gamification, they want to click through, and you fought hard to get the integrative report on Rupa. And I'm so glad that you did, because it makes it so entertaining, fun, and easy. And when you do that, it's easy for the clinician to implement and the client to achieve. And so it's just awesome.
I mean, how do we do better than that? So I just want to, we can end now, but I just want to say, it's been amazing working with both your companies and both of you. But that's nothing compared to how excited I am for what the future looks like. And I just can't wait to see what happens with Rupa and Fullscript, with 3x4 embedded, and how we just really start developing a real whole person care, and that is nurturing, that is safe, that has got the education, the engagement. So thank you so much. And it's cost effective, thank you. Very relevant and cost effective, because we need to do better. We need to do better, and this is definitely looking like we're on track. So thank you, Dr. Jeff Glad. Thank you, Dr. Kate. And looking forward to talking in a year's time and seeing where we are.
Love it.
Us too.